All right, some COVID science updates for today. So I like to read stuff about how COVID works and what you can do about it. And I've read a couple of different things today that I think are interesting. Uh,
One of which is that there has been a noted problem with hypocalcemia in people who are hospitalized, or at least a study was done in Italy on that. So lower calcium levels, also bad for you if you have COVID, but that might actually kind of go along with the vitamin D and stuff like that. It's always a little hard to tell. So calcium is indeed a key element in your body, and it's important. And maybe I'll talk more about that another time, but I did notice that. I read a paper that reviewed some of the thrombosis or clotting incidents that are associated with COVID. And interestingly enough, I would call it more good news on the clotting side, because there's clearly clotting issues. It increases various clotting factors in the body. We've known that now most of the time that this virus has existed. I've read a number of papers on it. But it does seem that most of that clotting occurs in the pulmonary area, and possibly because of the way pulmonary clots work, heading up towards the brain. It does not seem to be causing DVT, deep vein thrombosis clots, which means that the clotting situation is a little bit more localized rather than completely widespread and causing like all kinds of clots. So that's good. What's bad, of course, is that clots in the lungs and that lead up to the brain are both really dangerous clots. So that is inherently problematic. Anyway, the most recent paper that I was just made my way through was doing pathological autopsy of coronavirus, mostly from victims from China, because it takes a while to do autopsies. So at this point, we're not getting a lot of the most recent stuff. So my sort of summary of this. So first of all, pathological autopsies take time and energy. So these are not like large, wide scale, hundreds of people's studies, so much as they are individual type case studies, but quite a few of them were covered in the paper, and they went through kind of each one, but probably not more than 20 of them. So it's a little bit of a tough game. But here's what I find interesting about what they're finding is they look for what cells are being directly infected by SARS-CoV-2, which is the virus that causes COVID-19. And mostly it does indeed infect lung tissue. Lung tissue is the place where the virus is the happiest, is doing the most replicating, and is clearly causing the most initial and physical damage. It can get to other organs, and it has been specifically shown in the liver, kidney, and spleen, according to this one. Now, that doesn't mean that those are limitations. Obviously, this virus is pretty good. It goes for receptors that are in a lot of places, so it could get other spots, but those are the places it's mostly finding it. They didn't find it on a lot of the vascular epithelial yet. So there are vascular epithelial issues associated with COVID, but it doesn't seem like SARS-CoV-2 is actually infecting those. There've been a lot of back and forth conversation about whether or not the virus was infecting blood cells, and then whether the virus was infecting the epithelial cells, the lining of your blood vessels. And if these autopsies are accurate, the answer seems to be probably not, which means that all the rest of those factors come from the other activities of the virus. Now, it does have other activities. It affects the body as a whole. It kicks back a portion of the immune system while allowing another portion of the immune system to come forward, which is bad because it kicks back the portion that would actually do you good, and the portion that is essentially improved upon is the one that causes the cytokine storm, which is where your body can't figure out anything else to do and just essentially starts shooting essentially flaming arrows at everything. And that's the inherent problem, is that when you shoot flaming arrows at everything, sure, you kill a virus, but you also kill a lot of your own cells. So that's problematic. But so, and obviously the other factors that affect the endothelium, especially inflammatory factors, are directly related to being infected with the virus, but not the virus infecting those cells. Good news for that seems to be that if you can kick back these inflammatory responses that are out of whack, that might continue to be one of the best treatments. And I am seeing that that is the best way to go. It's hard to do. Kicking back inflammation is hard. I know I've been trying to do a regular version of that in my own life for years, trying to do it under viral circumstances, even harder. But hey, at least we're getting the idea of where to go and what to do. But if you were curious about where the virus seems to infect and where it doesn't, still mostly lungs, few other organs, but widespread effect via chemicals and the associated activation, inactivation of the immune system, which I think I'm going to look into more for the future. So I thought that might be interesting to you all. Thanks.